Now we'll see about dural venous sinus. So yes, what are the three layers of meninges that cover the brain? Yeah, so here, this is the brain tissue, right? Closely applied to it is the pia mater. Pia mater க்கு வெளியே இருக்கிறது, yes, that's the arachnoid. And outer to the arachnoid, what is shown in gray color here, that's the dura mater. So brain cover பண்ணிருக்கிற dura mater is of two layers, right? The outermost layer, which becomes in close proximity to the inner surface of the skull, that's called the endosteal layer. அதே மாதிரி arachnoid பக்கத்துல இருக்கிற இந்த membrane கீழே innermost layer, it's called the meningeal layer. Okay, so the meningeal layer என்ன பண்ணும் அப்படின்னு பார்த்தீங்கன்னா, it goes between the cerebral hemispheres to form a fold called the fox cerebri, between the right and left cerebral hemispheres. அதே மாதிரி cerebellumலயும் ரெண்டு hemisphere இருக்கு இல்லையா, அதுக்கு நடுவுல இந்த meningeal layer போய் ஒரு fold form பண்ணும், that's called the fox cerebelli. And again another fold it forms, which is like more like a tent shape. இதுக்கு பேரு tentorium cerebelli. இதுக்கு மேல இருக்கிறது வந்து occipital lobes of the cerebrum and கீழ இருக்கிறது வந்து cerebellum. Okay, separating these two, tentorium cerebelli. இன்னொன்னு வந்து பாத்தீங்கன்னா, over the sella turcica pituitary gland இருக்கு இல்லையா, அதோட மேல roof மாதிரி இருக்கிறது வந்து பாத்தீங்கன்னா, that's called the diaphragma cellae, which is pierced by the stalk of the pituitary gland. So these are the dural folds. Okay, so எந்த இடத்துலலாம் இந்த endosteal layer meningeal layer பிரியுதோ, okay, meningeal layer will go to form the fold, and where the meningeal layer separates from the endosteal layer, we have the dural venous sinuses. So நார்மலா ஸ்கல்லுக்கு வெளியே இருக்கிற வெயின்ஸுக்கும் ஸ்கல்லுக்கு உள்ள இருக்கிற இந்த டியூரல் venous sinusக்கும் என்ன டிஃபரன்ஸ் பாத்தீங்கன்னா, like any blood vessel, we have tunica, intima, media, adventitia, right? In the dural venous sinuses, they are very thin walled. Endothelium மட்டும்தான் இருக்கும். That's why it has the outer dura mater for support. Okay, yeah, they are only endothelium and they are very thin walled. Yeah, so இதுதான் நான் சொன்ன fox cerebri that lies between the, yes, between the two cerebral hemisphere. இங்க பார்க்கிறது fox cerebelli. Okay, so in the upper border of the fox cerebelli, நம்ம பார்க்கிற அந்த dural venous sinus பேரு superior sagittal sinus. அதே மாதிரி இங்க lower border, what we see here is the inferior sagittal sinus. Okay, and in the இடம் where that fox cerebri is going to come and sit over the tentorium cerebelli, அந்த இடத்துல we have something called as the straight sinus. Okay, straight sinus. And இங்க கீழ, yeah, you see the dural fold fox cerebelli. Yes, அதுல இருக்கிறது வந்து occipital sinus, and this is the smallest of the dural venous sinus. So இதுதான் நான் சொன்ன tentorium cerebelli. Okay, so இதோட sides இருக்குது இல்லையா, these are the transverse sinus. Okay, and inga over the lesser wing of the sphenoid, that is the sphenoparietal sinus. Okay, and on the side, either side of the body of the sphenoid, this is a very important cavernous sinus. And inga irukkiradhu, right over the median plane, over the clivus, in the part where the pons is going to rest, that's the basilar venous plexus. In the cavernous sinus of both the sides, they are connected by the intercavernous sinus, anterior and posterior intercavernous sinus. இது petrous part of the temporal bone. இதோட upper border occupy பண்ணிருக்கிறது superior petrosal sinus and கீழ இருக்கிறது inferior petrosal sinus. So we can divide these dural venous sinuses into paired and unpaired. So இதுல unpaired என்னன்னு பாத்தீங்கன்னா, superior sagittal, inferior sagittal, straight sinus, occipital sinus, இங்க நம்ம midlineல பார்க்கிற anterior posterior intercavernous sinus, basilar venous plexus. இது எல்லாத்தையும் நம்ம unpaired dural venous sinus னு சொல்லுவோம். All the others will be paired dural venous sinus. Okay, and this point, okay, where there's the meeting point between the superior sagittal sinus and occipital sinus, the right and the left transverse sinus is called as the confluence of sinuses. So this skull occipital bone or the inner aspect la irukra internal occipital protuberance kuda correspond agum, right? So here, this is the superior sagittal sinus. And இது பாத்தீங்கன்னா இதெல்லாம் வந்து superior cerebral veins. All these cerebral veins, superior cerebral veins will be received into the superior sagittal sinus. Right? And this is the inferior sagittal sinus. In the inferior sagittal sinus, என்ன பண்ணும் அப்படின்னா, there's something called as the great cerebral vein of Galen. அது கூட சேர்ந்து form பண்றதா straight sinus. Okay? So that's the straight sinus you see here, the junction between the fourth cerebri with the tentorium cerebelli. Right? I've showed you the superior and inferior petrosal sinus. This is the superior petrosal sinus, right? And here the lower border, this will be the inferior petrosal sinus, which is going to pass through the anteriormost compartment of jugular foramen and open into internal jugular vein. Right? We have two transverse sinus, right and left. Adula superior sagittal sinus will become continuous with the right transverse sinus. And the straight sinus will become continuous with the left transverse sinus. In the ரெண்டு transverse sinus நம்ம further trace பண்ணோம் அப்படின்னா, they'll become continuous with the sigmoid sinus. And this sigmoid sinus is a very important sinus that's going to collect the tributaries that drain the ear. Okay, which is located in the petrous part of the temporal bone. Cavernous sinus ரொம்ப 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 முக்கியம். எங்க இருக்குது? So this is, you see, this area is the sella turcica, which lodges the pituitary, right? So it's located on either side of the body of the sphenoid. Okay, so முன்னாடி பாத்தீங்கன்னா lesser wing of sphenoid, superior orbital fissure வரைக்கும் போகும். பின்னாடி இங்க பாக்குறது வந்து நம்ம apex of the petrous part of the temporal bone. So that's going to lie within the dura mater, right? So இதோட roof and the lateral wall of the sinus will be formed by the meningeal layer. Whereas the bony structures, அதோட floor and the medial wall, which is going to be bony, that is going to be lined by the endosteal layer. Okay. So in the cavernous sinus, the importance is because of its relation and structures that are going to lie outside the endothelium. So மத்த venous sinus மாதிரி cavernous venous sinusலயும் இருக்கிறது venous blood தான். இந்த எண்டோத்தீலியத்துக்கு வெளியே இருக்கிறதா இதை வந்து ஸ்ட்ரக்சர்ஸ் இந்த lateral wall and floorனு சொல்ல போறோம். So lateral wallல ஹையஸ்டா நம்ம இங்க பாக்குறது வந்து பாத்தீங்கன்னா third cranial nerve, oculomotor nerve. அதுக்கு கீழே fourth cranial nerve or the trochlear nerve. அதுக்கும் கீழே நம்ம இங்க பாக்குறது ophthalmic division of the trigeminal nerve. Okay, right? And this has been taken out. So only these three structures in the lateral wall. அதே மாதிரி floorல பாக்குறது பாத்தீங்கன்னா இது வந்து internal carotid artery in the floor of the cavernous sinus. So this lies in the floor. இது பக்கத்திலே இருக்கிற அந்த yellow structure. This one is the abducent nerve. Okay, so எல்லாமே eye related, right? So these are very, very important. And relations பார்த்தோம்னா, yes, medially you can tell this is the pituitary gland. அதுக்கும் கீழே இங்க நம்ம பார்க்கிறது sphenoidal sinus. அதுக்கு கீழே பார்க்கிறது nasopharynx. Okay, இன்னும் மேல பார்த்தோம்னா, this is your optic chiasma, which is going to continue as an optic tract. The roof appears பண்ணிட்டு வர internal carotid artery. This will be the temporal lobe of the brain laterally. Trigeminal ganglion, இதுவுமே lateral relation இருக்கும். Right? Tributaries are very, 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 very important. So the tributaries are from the brain. Tributaries are received from the orbit. Tributaries are received from the meninges. Okay. So you can remember it as BOM, brain, orbit, and meninges. So brain la pathona nama cerebral veins, superficial middle cerebral vein, inferior cerebral vein. Orbit la pathina ophthalmic veins, allame superior, inferior ophthalmic vein, central vein of retina. And from the meninges will be the sphenoparietal sinus, middle meningeal veins, idellame. And the communications of cavernous sinus is very important. So in the orbital veins, they will be communicating with the pterygoid and pterygoid venous. Yeah, so you can see the pterygoid venous plexus is an important point of communication. Face the dangerous triangle of face படிச்சிருக்கோம் ஞாபகம் இருக்கா? So this part of the face is going to be drained by deep facial vein. And the deep facial vein will open into pterygoid venous plexus. And pterygoid venous plexus will have communication with cavernous sinuses. So in the part of the face, medial angle of the eye, the nose, the side of the nose, upper lip, the area between the nose and the upper lip, right? Idilalam pimple acne vandichna enna solluvom, we shouldn't touch it, any pustule, because infection this area can travel to the cavernous sinus thrombosis that can lead to meningitis, encephalitis அந்த மாதிரிலாம். Okay, and the dangerous layer of the scalp, the loose subaponeurotic tissue, அதுல உள்ள emissary veins, they also have communication with the dural venous sinuses within the cranial cavity. They can be a source of transfer of infection from the scalp to the within the cranial cavity. Okay. And yeah, the importance of cavernous sinus about cavernous sinus thrombosis, right? So what is this thrombosis அப்படின்னு பார்த்தீங்கன்னா, okay, so என்ன ஆகுது, இன்ஃபெக்ஷன் ஃபேஸ்லயோ ஸ்கேல்ப்லயோ இருக்கு. அந்த இன்ஃபெக்ஷன் வந்து அந்த கம்யூனிகேஷன் மூலமா கேவர்னஸ் சைனஸ் குள்ள ரீச் ஆகுது. இங்க என்ன ஆகுது, அந்த இன்ஃப்ளமேட்டரி ரெஸ்பான்ஸ் ஜெனரேட் ஆகும்போது there's a stagnation of blood that favors thrombus formation. So imagine a thrombus within the cavernous sinus. என்ன ஆகுது, பிரெயின்ல இருந்து, ஆர்பிட்ல இருந்து, மெனிஞ்சஸ்ல இருந்து veins are pouring out the deoxygenated blood into the cavernous sinus, right? So இங்கேயே ஏற்கனவே இடம் இல்ல. அப்ப அது ஆர்பிட்ல இருந்து, மெனிஞ்சஸ்ல இருந்து, பிரெயின்ல இருந்து இங்க blood, venous blood dump பண்றதுக்கு இடம் இல்ல. So there is venous edema, right? Orbitல. Okay, so the orbit itself looks edematous, right? Exophthalmos. There'll be pain, tenderness of the eye. Okay, and in the cranial nerves the lateral wall 3, 4 and ophthalmic division. Ophthalmic division, you know, is going to carry pain from the eyeball, sensation over the orbital mucosa adella. So retroorbital pain எல்லாம் பயங்கரமா இருக்கும், tenderness இருக்கும், eye வந்து swollen இருக்கும், right? Edematous இருக்கும். And it can or the inflammatory response within the cavernous sinus can also involve the structures that lie in the lateral wall, third nerve, fourth nerve, ophthalmic division of the trigeminal nerve, and floorல இருக்கிற sixth nerve involve ஆகி அந்த palsy-க்கு போகும். Okay, and another condition, the video I took from YouTube. Okay, so any fracture of the base of the skull which can rupture the internal carotid artery in the cavernous sinus, that'll be what will happen, a mixture of the venous blood and the arterial blood. So over வாட்டி என்ன ஆகும் அப்படின்னா, the arterial pulsation will be transmitted into the orbit and the patient will present with pulsatile exophthalmos. Okay, so cavernous sinus thrombosis is actually very, very important. Make sure you know every point about it, right? Thank you.